right, everybody, welcome back to another episode of the Fearcast. This is the podcast dedicated to OCD, anxiety spectrum disorders, and getting your life back. I'm your host, Kevin Foss, and I'm a licensed therapist specializing in OCD and anxiety disorders. Thank you all so much for joining me. So while this is typically a question and answer based podcast, today I'm not going to be answering a question specifically, but I'm going to have on, this is an interview question I have with a couple of therapists who were kind enough to join me to talk about health anxiety. It seems to be a bit of a theme going on. I had an episode a couple episodes back talking about kind of an overview of health anxiety, but today I got a chance to interview two folks that are the authors of a book that is currently out. You can currently go and purchase this book on health anxiety. So I'll tell you a little bit about them in just a moment, but if you have a question for them or a question about health anxiety, they've agreed to join me for a future episode if we get questions about health anxiety. And so you can send those questions in by going over to fearcastpodcast.com and sending me a message over there by clicking on the submit a question link. You can also send me an audio question over through Instagram. I am over at Instagram at fearcastpodcast there. And you can either send me a text there or send me a DM, or you can send me an audio DM there. That's kind of the easiest way to send in your audio questions. If you notice on some of the episodes, you'll hear audio from some listeners. They send me an audio typically there. They just send me a DM and they record their voice there, or you can record your voice on your phone and just email it to questions@fearcastpodcast.com, or go over and send me the link to a shared Google Drive, etc., etc. You've heard me talk about this before. So let me introduce the two authors, and then I'll jump into the interview. So the two authors are Dr. Josh Spitalnick and Michael Stier. They are both with the Anxiety Specialists of Atlanta, and they are anxiety and OCD specialists. As I mentioned before, they are the authors of the book, The Complete Guide to Overcoming Health Anxiety, and the subtitle, which is fantastic, is Because You're Not Dead Yet. So I had a great time interviewing them. They're very knowledgeable, very thoughtful people, and they offer a great way to start viewing struggles with health anxiety, how to overcome health anxiety, and how to work with the realities of being a human with health and anxiety. So without further ado, everybody, here is my interview with Dr. Josh Spitalnick and Michael Stier. All right, Josh Spitalnick and Michael Stier, thank you all so much for joining me today. These are the authors of the the Out and About book on health anxiety, how to live your life to the fullest because you're not dead yet. Thank you so much for joining us today.
Thanks for having us.
Thanks for having us.
Yet. Well, yes. Awesome. Well, I appreciate both of you joining me today to talk about the book, but more importantly, just talking about the subject of health anxiety and treating anxiety just in general. So we were bantering about back and forth on where we wanted to go in this episode and how we wanted to address this. But I suppose, why don't we start by talking about what's health anxiety, and how do you what is treatment for health anxiety in general? So you fix everybody. You guys can do that, right?
Yeah, we can. I think we can fix everybody, right? Yeah. Right. Well, and when we think about health anxiety, and this is what I think is important about how we started this book. You would think that the first chapter that we would start with would be about health anxiety.
You would think that, right?
You would think. But I think what's important about this and how we were kind of structuring the book is that, we could look at, and it's important to kind of create those distinctions with health anxiety, but it's also important about what kind of mindset that you can bring into this as well. Because if we come into it with a mindset that's not very helpful, you can have all the knowledge and information about what to do in some of these situations, but it's important to be able to have that as a foundation as well. If we're going to jump into chapter 2, so if you're going to skip chapter 1, which I think we put in there somewhere to don't do that. So, and definitely. If you did, we try to catch
chapter
you.
1.
Yep, correct.
Back to the beginning.
The answers are in the first chapter, but if you go to the second chapter,
Yeah, exactly.
You just gave it all away. You just ruined the whole book. Oh, man.
So hopefully they listen to this after they read the book, so they don't get that. But when we think about health anxiety, that's just kind of sometimes whenever I give presentations, I kind of mess with people, and I say, hey, we're going to talk about health anxiety today, but just kidding. There's really no such thing, although there is. But that's what we just kind of lovingly call some of these different things that can happen, such as illness anxiety disorder, somatic symptom disorder, and then also we talk a little bit about OCD in the book too. And people might read that and they say, wait a second, OCD, I thought we were talking about health anxiety, but I think what we can recognize is that these things work quite in a similar fashion. So when we think about these different things, and we can kind of get into them as we talk, but these are the three categories that we're kind of talking about and this is kind of what we put under our book as the, kind of the culmination of what we would call health anxiety, which is just being very scared about some of the experiences that we might have, or things that could happen, or what a symptom could mean. And sometimes those just really get stuck and become intrusive to life. Josh, what would you add?
Yeah, so when we talk about health anxiety, Kevin, I think it's critical to know that sometimes it is actual fear about your real medical issues. And though that's not the diagnoses that we're often talking about that Michael alluded to, if you have a medical issue, acute or chronic, and you're worried about it, that's still health anxiety. And we just call it something else. We usually call it an adjustment reaction or something like that. But a lot of the times people have fears about their medical well-being when either there's no proven medical issue or there's no physical issues going on. And so those two categories is really where a lot of the book talks about. But as Michael said, we look at health anxiety as nothing more than a subset of what we view OCD to be, which is just a preoccupation with things that, for the most part, if you don't have an active medical issue, are you prognosticating or worrying about something that hasn't happened yet? And it's weird to say that to someone because we run support groups. Mike and I run free support groups. We run treatment groups, and we see people individually, like most people around the country. And I like to tell people that until you give me a proven medical issue. And by the way, if you do, we'll support you on that and we'll talk about that, which is not the primary focus of this book. But until you show me your diagnosis of cancer or Lou Gehrig's disease or diabetes or, tuberculosis or HIV, until you give me that, at a minimum, you either haven't been to the doctor and don't know, or the doctor's lying to you, or the doctor mixed up the labs, or the doctor hasn't gotten the labs, or you don't have something. And I don't know which one of those categories it is. What I do know is currently, if we're not dealing with a real medical issue, you don't have a medical issue for us to be treating medically, thank goodness, because we're not medical doctors. But you might have a physical symptom or a lot of physical symptoms that are scaring the, what out of you. And we want to support you and treat those. Or even if you have no physical symptoms, we know you're worrying. So the beauty is, Kevin, that whether someone has physical symptoms or not, we have a bunch of skills that we've learned from OCD that apply perfectly to how we treat health anxiety. And we're going to talk a little bit about that during this meeting today.
That's fantastic. I love that distinction between the two sides of things. One, you can certainly have anxiety about actual medical issues that you currently do have. And you can have anxiety, kind of the second category of fears about potential medical illnesses. I think in OCD land, we often talk about the potential and worrying about things that aren't in existence, but it's also incredibly valid to have anxiety about the physical illness that you currently have, but then imagination and fear can jump in about what's going to happen, what might happen, and that puts both people back in the same boat.
They're in the same boat. It's the same situation. And we even see people that have histories of medical issues. And because of those traumatic experiences, they're worried about the next bout with cancer, the next bout with said condition.
Absolutely.
But we don't treat it any differently. Again, it's without oversimplifying it. If you're battling a medical issue, not only should you be being treated and followed by a medical provider, but therapists around the country can support you in your medication adherence and the things you're struggling with and getting family to support you, all the things that someone would go through when they're battling genuine medical issues. But until you give me that medical diagnosis, and when we work with someone at the beginning, one of the first things that Michael and I talk about in the book and in our practice is, hey, if you haven't had a medical workup, if you haven't met with a physician and you're concerned about his issues, we want you to go meet with a doctor. We don't want to, not only do we not want to get in the way of that, we sure as heck don't want to start treatment if this can be simply solved with a pill or a procedure. But if you don't have a prevailing medical issue, either because you don't have it or you don't know of it yet, there's still lots of work that we can do. And Kevin, that's identical to OCD. I don't know if something bad's going to happen to you. I don't know if you're going to do something bad, but until it happens, I'm going to operate like you don't want to, or you're not going to, because that's all the information I can work on: the here, the now, and the facts. And as we say, if it happens down the road, you don't need a therapist. You need a judge, a lawyer, a rabbi, or the clergy. And we'll be there for you, and we'll cry with you, and we'll support you. But until that terrible thing happens, let's talk about how we can live in the now, do things that align with your values, face your fears head on that are safe, and teach your world that's bigger, not smaller.
So I suppose we'll end it here then, yeah?
Have a good night, guys.
Right. There we go. All right, that was a good episode.
Fixed everybody. Well, I suppose, all right, I suppose to get to that. So you talked about thinking differently. I think there's a tremendous shift that needs to happen. I think for every single person that we work with, for every single person, there needs to be this mental shift about what it means to think about your health, think about your relationship with it, and then your relationship to the world in your future. We hear a lot of things about, being careful about your health. We see ads. I don't know. Y'all are in Atlanta, California. We have all these ads for medical conditions. Do y'all have those? Or medicines? All right. It's
medicines, COVID, masks, you name it.
Yeah. So we're inundated with care for your health, look for your health. Hey, have you talked to your doctor about this thing? So it feels as if we ought to be caring for our health as the most important thing in our life. But you're also talking about this mental shift that needs to take place. Can you tell me about this shift?
I think the one thing that comes to my mind, and I was having a wonderful discussion in one of our consult groups this morning that I get the pleasure to be able to run, is this is a really hard decision because we have health and we also have anxiety around health. And in a lot of other ways, we might be able to rule out one or the other. Not many times are we going through and testing for, certain things with OCD to be like, let's make sure you're not this or that. And also practicing therapy around that. Not usually. We're identifying those things as ego dystonic, most likely, and moving forward in that way. Health, it kind of becomes a different ballgame because surprisingly, sometimes people deal with more than just one health issue. Or there's other things going on top of the things that are also scaring them. So we kind of have this parallel process that I think makes it kind of challenging, where if we have anxiety around our health and we're also getting medical treatments for things get a little muddy at that point, because then we have to work to be able to separate out what goes into what category. How do I know what to pursue or not to pursue? And it starts to get really jumbled in those cases. So I think what's important is as we're working with people, and I think what's important is being able to start to have those discussions. And one of the things that Josh had mentioned a little bit earlier that I think him and I do a lot of, I think it's an important integral part of this, is to be able to try to get all of these parts and pieces of the treatment team on board in terms of whether we're getting background information from the client or coordinating information or with their permission, being able to try to talk and discuss some of these things with medical providers can be a huge asset, not only on the aspect of being able to kind of know maybe how to handle some of these things and how to navigate these things in the therapy room, but also on the outside of that is being able to work with the medical team just in case if there's a lot of times where I'll hear people say it's like, well, if this test will just make you feel a little bit better, we'll go ahead and run it. And that starts to become problematic. And not only in a bad way, because of course, like they're people, they're doctors, they're helpers. They want to be able to help people, but sometimes they just run out of what do we do at this point? You keep coming back, we keep trying to find something, but it's hard to just let a person leave in despair. And so I think that's where we think about there's some nuances with health anxiety that stick out to me that's just really important to consider of how do we try to address those and how do we kind of create those separations, which is exceptionally challenging. Because if only some of the symptoms of anxiety and the symptoms of health anxiety were mutually exclusive, that would be nice. But there is
for us, definitely.
Yes. Yeah. There's no chest pain from anxiety and chest pain from heart attacks that are, those are unfortunately not necessarily different symptoms, although the origin of those symptoms might be different.
Well said. So this is the dilemma we have, Kevin, which is, again, I'm starting with the assumption that the person we're talking about, the populations we're serving, don't have a prevailing medical issue. And if they do, again, treatment goes a little bit of a different direction. But our goal is to make sure that if you don't have cancer, that you don't spend your time having cancer. And the reality is there are people walking this earth right now with significant medical issues. This is a sad thing. It's not a funny thing to say. It's a sad thing. There are people walking this earth right now with severe medical issues, people that are dying, people that are on the precipice of stage 4, stage 3 cancer, of finding out that they're going to require surgeries that might be impairing to them, that are living a more full life than the people who don't have those medical issues, but who live in fear of them. So whether there are physical symptoms right now that are confusing you or not, if you don't have an identified medical issue because you don't know about it or because it's not there, but you're acting like you do, your life is not as positive, healthy, and full as the person who is fighting like HE double hockey stick to have the life that they want, whether they have 2 weeks left or 20 years left. And so, again, it's not a joke to us, but it's a bit ironic that for someone who doesn't have cancer, they're living a life worse than someone who's battling and fighting cancer. Like most of us, we know if you get diagnosed with something like cancer or some other severe illness, what are we going to do? We're going to go get a consult. We're going to go get chemo. We're going to go get surgery. We're going to put on our pink outfits and run marathons and raise funds and fight like hell to try and beat it and get our community to support us around that. But for those of you who don't have cancer or ALS, or you're about to have a stroke or a brain tumor or debilitating illnesses, there's no marathon. There's no pink tutu. There's no fundraising. So you're not even getting the benefits of having your community and people to support you, and you're suffering in silence. And Michael and I and you and everyone out there who supports people with health anxiety hate that. I hate that you're suffering in silence for a condition that, in a weird way, you can snap your fingers and go, man, if I can give up the rituals and the compulsions, and if I can honor the fears that I'm having and recognize that the fears are real in my head, but they may not be really predictive of what's going on. If I can snap my fingers and stop the rituals, which is what we all have a goal for, and not engage with that story or narrative of anxiety, I actually can stop a disease. I can't snap my fingers and stop cancer, AIDS, stroke, debilitating diabetes, heart issues. There's no snapping of the fingers to stop that. But we have skills like ERP, ACT, ICBT, metacognitive interventions, medications, yoga, prayer. I mean, lots of them that are out there. We like to talk about the evidence-based ones that you can actually behaviorally and cognitively change things and actually be sub-diagnostic. That's wild. No one has that offer in medical. Not a single medical condition out there, Kevin, that you and I can go, if you talk to a therapist and change the way you are, you can no longer have that medical issue. But with health anxiety and OCD, that's a real thing. That's wild. And yet it's hard to get someone to get there.
Yeah. When you work with folks, because all of that sounds incredibly encouraging. Sounds
we needed awesome. The music. We need the Rocky music in the background, didn't we? The John Williams soundtrack.
I'll put that in post. But
perfect.
All that said, right? A lot of the folks we work with immediately go back to, yeah, but it feels so real. Or it could. I could have this. I have had this. I have a family history of having this, so I might have it. Right? And that's, I mean, that it just feels like you hit a roadblock with that in a sense, almost as if like the train stops, you hear the record scratch.
Yeah.
How do you help someone to make this turn, this shift, to view it not as a medical issue, but view it as instead an anxiety issue? Because I think that to make that turn, that's the life-changing first turn of all of this.
So it's not accidental that Michael and I, who wrote a book that we're very proud of, has some smart-assy kind of titles and goofy metaphors and funny dad jokes. They're not all funny, and stories and narratives and songs and other things in this book. The first chapter of this book, Kevin, which again was written by Michael and I, published by an awesome production group called Live with Fear Productions.
Look it up. That
Michael and I launched. Yeah, you know, the first chapter is actually titled, this is powerful. You ready? Dun, dun, dun.
Ready.
The first of 10 chapters to overcoming health anxiety. I mean, come on. Who gets away with that? The first chapter is titled the first of 10 chapters. And why is that? Because it's about the mindset that Michael introduced earlier. And that is that we have to convince people at the beginning that you're going to do that Indiana Jones Temple of the Last Crusade leap of faith, where you can't see the platform and you're reading these scriptures and like you're supposed to take that step off and hope that the ledge is there. And we're asking people to take a leap of faith. Not that we know that they're dying or not, but that there are things that they can do to live a more full life, even if they are battling a medical issue. So the first chapter is about getting people in the mindset of how do you face fears that we believe in the moment are not life-threatening. If they are, again, all the rules change. How do you face fears and belief systems and narratives and stories that are not life-altering? And if you can face those head on by acting differently, thinking differently, and embracing things that bring on some potential risk and uncertainty, you've at least opened up some space to do something different. And so that's why we actually spend the first chapter not even talking about health anxiety. We talk about what it means to be an anxiety specialist. Kevin, you're one, I'm one, Michael's one, all the people that we surround ourselves with in the community are anxiety specialists. And that means that we ask people to do things that feel impossible. And I emphasize feel, but they're not impossible. We ask people to do things that feel like that they're risks, but we don't put people in danger. We ask people to change narratives in their minds that make their world bigger, not smaller. We ask people to help battle symptoms when we're really trying to change systems of thinking, systems of attitude, systems of the way things are supposed to be. So anyways, it all begins and ends with getting someone to recognize that they have more control over what they think and what they do, maybe not what they feel, but what they think and do. And if they take that leap with us, maybe just maybe they'll find a bigger, more compassionate world. But you're right. It's the hardest sell part when someone has spent thousands of dollars, gotten spinal taps, gone to multiple doctors, disregarded, relevant information, spend all their time on Google. They have a pulse oximeter and a blood pressure cuff and a thermometer and their Apple Watch and all the things that tell them how healthy or not healthy they are. And they're so wedded to that. The first stage of therapy for us is helping them disconnect from all those traps that we believe are keeping them stuck. And for most of us, we call those rituals, compulsions, safety behaviors. So besides changing your mindset, the first negotiation with our clients, aside from educating them about what health anxiety is we start highlighting what are the compulsions and rituals that you're doing. Again, Michael said, this is very much OCD language. We're adopting that language because health anxiety eerily mirrors OCD. So what are your triggers, obsessions, and compulsions? But what are the compulsions? What are the actions of mind and body that you're doing that are keeping you stuck? And if we can separate from those and drop some of them, maybe, just maybe, your life can be a little bit better.
I love that mindset first off, I love the title of that first chapter.
It's special.
It's both sarcastic and also incredibly descriptive. It is indeed the first chapter of the book.
You can't debate that.
No.
Yeah. You can't debate that.
It's truthful. Yeah.
It's truthful.
Yeah.
I think if I ever write a book, I think the fourth chapter will just say, like, just like the first, this is now the fourth. But all the other ones will have cutesy names to it.
We expect if you do, we expect royalties, please. Okay, royalties.
Well, we shall talk about that in the ongoing.
We will.
But yeah, and I think there's there can be such a mentality and an identity to all of that you're talking about. They kind of, some folks can get into this habit of just saying, like, they might not use this language. I'm the sick person. I'm the person who has anxiety. So it's to say, my life is about this because once I solve this, then I can do that. But until then, this is who I am. So to kind of break away from that, that worry of this is all the stuff that's keeping me alive, right? So if I drop that, I'm just going to drop dead. Or if I drop that, then it's just downhill into accepting my inevitable fate. Ultimately, at the end of the day, for all of us who have worked with health anxiety, have talked about this, have been in this world long enough, and are then going to trust what the doctors have said, we know that, or we can trust that that's highly unlikely. That if that were to happen, you let go of all that and you embrace the health that you presently have, as good or as bad as it is that day.
Most of us who are licensed mental health professionals don't want to go to therapy jail. Kevin and Michael, would you agree?
Correct.
Yeah.
Is it in Hawaii?
If it is, I'd reconsider that. So I don't know where therapy jail is, but I don't think I want to be in jail with a bunch of therapists. So knowing that I don't want to go to therapy jail, write that down, therapy jail. That might be the next book, therapy jail.
That's a good shout.
Knowing that I don't want to go to therapy jail, and I'd love to not be sued, and the belief that I'm not trying to kill my patients, I'm not trying to take liberty with someone's health. I don't even know if their health status is even accurate. For all I know, again, the doctors have overdiagnosed or underdiagnosed their condition. But when I'm operating with information that tells me currently that you're medically not ill, even if you're physically not doing well, or you're physically okay and just worrying, that is a critical moment in therapy where I have to then tell someone that if you're not battling that and you're wedded to focusing on your illness, we could possibly be at an impasse. If you're not wedded to that, then treat me like a flight attendant, where if the plane feels wobbly and the wings are kind of going, oh my goodness, and maybe there's some bumps and turbulence, and the flight attendants are serving peanuts, cookies. I don't think they do peanuts anymore. So sandwiches, they're walking up and down the aisle.
Kill people, Josh. Come on.
Peanuts do kill people. Talk about health anxiety. That's space there. But my metaphor is still appropriate here, which is if the flight attendants aren't freaked out either, they're the best paid actors and actresses in the world because they know they're about to die, or they're not concerned at all because they know what the smell of gasoline or wings wobbling or bells going off or turbulence or fake air pockets. By the way, air pockets are not real things, so you can look it up. They know what's going on. So treat me like the flight attendant. If I'm not freaked out about your non-medical status and I don't want to go to therapy jail, maybe, just maybe, put some faith and trust in your therapist, which again, Kevin, is one of the hardest things to do, because that means you're giving up all those things that you've been holding on to, all the things that have kept you, quote unquote, alive, that I think are actually killing you in real time. So I'm your flight attendant. Either I'm the worst actor in the world and I'm trying to kill you, which I don't think any therapist is trying to do that, or maybe, just maybe, I've seen this before. I know how to help you. And again, in the course of treatment, if accidentally or suddenly you're battling a real medical issue, guess what we're going to do? We're still going to be treating all the worries and concerns you have. We're going to consult medical doctors. We're going to support you. We're going to cry with you. And we're going to do everything we possibly can to keep you as healthy as possible. But if you're not battling that medical issue, man, trust me, follow me, join me. I sound like, what's your name on Grey's Anatomy? Join me, follow me, trust me, do it. Join us. Listen to your flight attendants. They know what's going on here.
And one thing I just wanted to add too, kind of going back to your, a little bit to your question and kind of what we're talking about here, Kevin, is that you mentioned this kind of piece of like, but it feels so real.
Yeah.
And I think that's a really important thing. I was glad that Josh was talking about the TOs and Cs, because I was going to skip to chapter 3, but we completely forbid that in the book. So I just didn't want to get out of order. Yeah, can't do that one. But in chapter 3, I think the other thing that we try to come back to address that question is it's a legit concern, right? Because when we were talking about symptoms, like you're saying, it's like, well, this really feels like a heart attack. I really feel like this is happening. So we have to figure out some conceptual way to be able to figure out how do we help people navigate that distinction. So we kind of break it up in chapter 3 in 3 different buckets that I think is important, which we start to talk about medical, physical, and psychological. And one thing that at least I tried to do, and I think Josh does this too, especially when we're thinking about health anxiety, is one of the things that I want to make sure that whenever somebody comes in with health anxiety, and anybody that's listening to this right now, if you're saying, but my symptoms feel real, the one thing I want to echo is because they are real.
They are.
They're not fabricated. They're not made up. I know I'm not trying to put anybody under the bus, but sometimes people go to doctors and they say, oh, well, this is just all in your head. And I think the thing that people leave feeling very discouraged about is the experience of like, well, these aren't real symptoms, although they feel real, but they aren't real, but they feel real. And it's just very discouraging place to be, especially sometimes invalidating. So one of the things that we try to set up, and I think is really important to understand, is that whether we're talking about a medical symptom, which we describe as, if you have a chest pain because you're having a heart attack, that requires medical intervention. That is a medical symptom. It's because of a medical origin. However, there's another category, or a second bucket, we could say, physical symptoms. We could have chest pain for very other reasons other than heart attacks. Sometimes it can be a symptom of acid reflux, or it could just be like, I've been gardening all day and I've been shoveling, and now the next day I'm like, oh my goodness, my chest feels so tight. That's not a medical symptom. We don't need you to run to the hospital because of that. But that does need some type of supplemental care. You need to take it easy for a little bit. Ice something, take an ibuprofen, you name it. And then there's also psychological symptoms. And these are still real symptoms that we feel, but a symptom like chest pain, still a real symptom, but we have to explore the idea that it could be also coming from a psychological origin, which of course, anxiety can create chest tightness. So when we think about this, like it feels so real, my response is absolutely 100% it feels very real. And whenever I work with clients, I kind of lay this out and we look at the different buckets and then we put one of their symptoms maybe at the very top. And I go, which one do you think your brain puts this into right away? And they're like, medical, totally. Yeah. 100% right into the medical bucket. And I think it's important to have this conceptual framework of, yes, of course, like that's the conclusion that our brain is going to, because it's scary. And in some ways kind of adaptive, because, if we had a bunch of different symptoms and we're just like, I'm sure it's nothing, that would probably catch up to us at some point, especially as we age. However, it's important to start to kind of create that distinction of like, all of these symptoms can be very real. We have to start to look at the question of, and that is either in discussions in therapy, also with the coordination with, have we gotten tests? What have they come back with? All of these different types of things. Which category are we going to start to put this in? Now, going back to Indiana Jones, and you forgot the Sean Connery part. But Sean Connery is the one that he keeps on going back to, and he goes, you got to just believe, Indy, right? And we don't have that in the book, unfortunately. I feel like
we do. We use the Matrix reference quite a bit.
That's true. That's true.
We go Matrix on that part. Yep.
Yeah. Okay. That's a good.
When he sees the code and gets what's really going on here.
Yes.
Kevin, you look baffled. Keanu Reeves is throughout our book, by the way. So we reference him. We adore him. He's one of the greatest actors of our time. I don't know why people don't love him as much as we do.
Reeves is.
Personally or professionally?
I can't talk about clients.
Come on. The whole Matrix movie is a metaphor for OCD and health anxiety. Things tackling you on the inside, and which pill do you take, and what do you listen to, and do you see the code? If you get the code, you know what's really going on. Fight off all the AI guys, and then you take over the whole world. Your world just got bigger. It is the perfect metaphor for understanding obsessions and compulsions. I digress. Michael, you were saying.
How many times have you seen that movie? Because if anybody's wondering, I think you can now have a general guess about how old Josh is. But anyhow, go ahead.
I've seen that movie hundreds of times.
Well, and I think that's where we come back to, right? And it comes back to this leap of faith moment. And that starts to become part of the therapy process, which is, and we come back to all those things in terms of valuable actions, et cetera, et cetera. Because we come back to this place of like, if I lay out the picture and I say, my pretty good answer is, this is probably from a psychological place. Mm-hmm. It is a bit of a risk to go with that.
I like you said that. Pretty good answer.
It's a pretty good answer. What else do we have? So, but I think that is important. And when we address these things of like, is this, but it feels so real. Mm-hmm. And so I think there's a place for that, to embrace this dialectic of like, absolutely it does. And also maybe the origin of these symptoms just may not be where you fear that they be. And how can we start to live our life in that way? Now, the other hard part that I'll just add, and we can expand upon this too, is that becomes a very difficult decision. Mm-hmm. And unfortunately, I can't make that one. And Josh, you can't make that one. And even Kevin, if you work with we can't make that decision of what is enough. Because I don't think that's a very fair place for me to make that decision. But it is a place that maybe you can come to a decision with a therapist or somebody supportive of in what ways, even though it might be scary to stop pursuing something, if there's not something going on, there is an inherent risk that lies there, which is I could miss something. This is where we get to our feared consequences. Maybe I'm brushing something off and I shouldn't be. I could have caught something earlier, and those are terrifying. Mm-hmm. And also, the consequences of following those might just be you may be living your life as you have the illness, even though you don't. So I think there's that distinction when we think about medical, physical, psychological, that's really important to honor that, yes, these are real symptoms. They just might not mean what you think they mean.
Yeah.
And all medical symptoms are physical and psychological. All physical symptoms are physical and psychological. So it streams downhill. Mm-hmm. And all psychological symptoms are psychological. So anyone who's having physical symptoms, there's no way they're not having physical and psychological aspects to them. Mm-hmm. And anyone who's having physical symptoms are inevitably worrying or concerned about them. Mm-hmm. And so we don't have to play judge, jury, executioner. We just help people put them in buckets, live with the facts, and then treat accordingly. And that gives them all the agency and power. Mm-hmm. We can accept, and Michael, as you said, I accept whatever your symptoms are, and I'm going to agree with you. I just don't accept or agree with the way you're handling them. And I want to teach you other ways to handle them so you live a more full life. Yeah. And if things change, if data changes, if facts change, we'll pivot, we'll shift, we'll deal with it. But I'm going to honor what you're reporting to me. I'm going to agree with the assessment of the experience. I just think there's a different way to respond between stimulus and what you do about it. And if we can teach people that little in-between change, welcome to ERP, ACT, ICBT, mindfulness, CBT, you name it. We got lots of skills to teach people, which is what the second half of the book is all about. All the skills.
Incidentally, is the second half of the book is called the second half of the book if you flip through it. It is not. You'll have to find that.
It is not.
Yourself. It is not.
We thought about it, but
it's a good name for it. This feels like, I feel like ultimately I'm getting at Spaceballs the book. So,
I mean, come on, that is one of the top three.
That would be the ultimate compliment.
And that is the book of all, the movie of all.
Although we wouldn't be able to sell merchandise.
Not yet. In the middle of the plague,
merchandise.
In the middle of the pandemic, I saw someone with a mask that said "Spaceballs the mask."
Nice.
I saw that.
Goodness. I high-fived that person, then quickly put Purell on my hand. You brought up an interesting point here, because there's kind of this balance with health anxiety that I find. Something I talk about with my clients is that, there's if you have a brand new symptom that you've never experienced before, go talk to a doctor about it. Like
100%.
Like have it checked out. And if the doctor says it's something, well, then treat it like it's something by what the doctor is saying. If they're saying it's nothing, then we treat it as if it is indeed nothing. But if it's a symptom that you have had before, that a doctor has said it is something, well, then treat it this time as if it is that something. And there's an avenue that you go down. You take a pill, you do a stretch, you do a something. But we don't then continually go back and say, well, maybe it's this something new, maybe it's something different. And also to that end, kind of this idea of if you have it and the doctor said, it's kind of fine, if it feels the same and stays the same, well, we kind of find a way to live with it. If it's getting better over time, great. If it's getting significantly worse and now limiting your function or it causes severe pain, go talk to a doctor.
Yeah.
It's kind of a rule of thumb. Sometimes, generally speaking, it works to help kind of guide. But Michael, as you were talking, it's an interesting question to say, like, at what point do we put a cap on getting tests and going to the doctor for a thing? Especially if they're having this question of, the doctors are saying they're not saying it's absolutely a designated something, but they're not saying it's absolutely nothing, but they're saying we don't quite know what it is. There's this symptom that's going on. At some point, we do have to put a cap then on how much work or how much stress we are wanting to put into testing, checking, all of that. And that is part of that's ultimately a question of response prevention and then acceptance of the uncertainty of what's now going to happen because we don't have, quote, the answer from the doctor yet again. And it's a hard question. It's a hard place to be. I suppose I was going to ask, how do y'all get into that? But I suppose that's a case-by-case basis.
I think there could be a couple thoughts that I just have about it real quick. And I know, Josh, you have some things that sometimes you like to throw in this too, so feel free. Two things that come to mind first is trust in your medical team is important. I just had somebody that I met with not that long ago, and they said they went to a doctor and they just really got a really bad vibe. Didn't feel like they were listened to. Didn't feel like they were taken serious.
Yeah.
And there was always this kind of question of like, well, should I just accept that? Like, should I don't know. And I don't think you have to. That when we're thinking about this aspect of, it's going to be important to have somebody that you can go to that is attentive, that listens to you, that makes you feel like, yes, like, we have these things that I'm hearing you. So I think there's an important piece that sometimes people are like, well, there can be a difference between, do I trust this person? Do I doubt this person? Or does my mind doubt this person? And so I think and trust is important. And also the other thing that I think is just important to acknowledge is that whether it's based off of, women just in general are often, research shows this, more dismissed. And also minority groups are more dismissed in medical communities. So we have to acknowledge that there are real things that go into that decision of, am I getting an answer, or do I feel like I'm brushed off, or do I, and so those are all legitimate. And I think those are two least important pillars that are important to consider before we start to try to make these decisions of when do I embrace uncertainty, because they are very real things that happen in the world. Josh, anything else that you'd want to add with that too?
Well, first of all, I appreciate you acknowledging that there are certain populations out there that are more marginalized and minimized when they complain of medical issues. And that is absolutely important to acknowledge. And Michael, as you started off, I love that, which is trust in your healthcare providers. However, if you don't, find a different one. Find someone that you feel honors your voice or understands your concerns. And, I know most of us probably are a bit disgruntled with the field of medical, of getting access to care and getting timely appointments. And that's a frustration most of us care about. There's three white men here having this meeting here, and most of us are probably more likely to be heard or understood or treated more quickly in certain populations. So I just appreciate you acknowledging that, Michael. We do acknowledge that in the book and in presentations that we do. But here's a critical sort of point for me on this, Kevin, that you brought up, which is medical appointments, X-rays, CTs, MRIs. First of all, to get those is not so easy. To afford them ain't so easy.
No.
But when you get those are discrete, individual, I call them like significant milestone moments. And so most of us have had guy or girlfriends who have gotten second, third, and fourth opinions, and thank God they did, because if they didn't, something would have gotten missed. And I have too many examples in my own personal world, including my wife that I've shared in other podcasts, where if she didn't get her fourth medical opinion, I could have been a widow. Something scary could have happened with a situation that she had medical years ago that was easily corrected with surgery and some rehabilitation. But if it was left untreated, I could have lost her to a ruptured liver. And I don't share that to scare people or to trigger them. The point is I don't know how many referrals and second and third and fourth opinions you need to get the answers you need. None of us do.
No.
What I do know is whether you're going for that recurring issue, Kevin, that you alluded to, you had something a few months ago, a few years ago, and maybe it came back, maybe it didn't. That if you want to set up another consult or another appointment, listen, I don't think it's up to me to decide whether you do that or not. But the 18 questions you ask your friend who's a nurse, and the 23 times you go online to Google, is it or isn't it? Mm-hmm. And the day that you spend wondering about all of the what ifs, all of those microscopic moments in between today and the appointment you have in 3 weeks. Again, those are 2 moments. My therapy session with you and that second, third, or fourth CT or MRI you're going to get, in 3 weeks from now. Those are 2 discrete moments. But in between moment A, my session with you, and that seminal medical appointment that will or will not prove what's going on, there's about 1 million opportunities to ritualize between now and then. And I can help you with those. So I might agree or disagree with whether you need another consult. But listen, I don't live your life. And I sure as heck don't want to be wrong and don't want to go to therapy jail. But between now and then, I know that there's a long list in the back of the book that Michael and I wrote, and on our website, by the way, overcominghealthanxiety.com. You can download and print those lists. They're in our book, and they're also on our website, that are filled with all of the funny and nuanced rituals that people do around health anxiety. And again, whether it's about food allergies or medical issues or cancer, kidney issues, heart issues, you name it, rituals and compulsions, it runs the gamut of all the most obvious and the most idiosyncratic things people can do. Going to appointments, avoiding appointments, asking people, not asking people. I mean, you can go either direction on that. Avoiding foods, eating foods to test it out. It doesn't matter which side you go. So, Kevin, in the back of our book, we list tons of rituals and compulsions that people do. And the beauty of that is if I can teach someone to eliminate, 50 to 70% of those microscopic behaviors, I really don't care whether they go for a third or fourth or fifth consult, because those are significant moments that will determine yes or no whether something's going on or not. But rituals and compulsions don't. So I don't know if that fourth consult is a compulsion or it's going to actually be the meeting that saves their life. But I do know going on WebMD, Google, asking your uncle who's a podiatrist,
Reddit,
checking things out online, Reddit, whatever, listservs you're on, avoiding news articles or reading news articles, those don't determine whether you have cancer. So, reading a story about cancer does not give you cancer. And avoiding stories about cancer doesn't give you cancer. So when you start doing those things that I don't believe add any value to your life, those are the things I want to eliminate, because that is the body of things that are sucking the vortex of hell out of your whole existence. And if we can attack those, I don't care if you go for another doctor's appointment. Do what you want. I don't care, because those individual moments are far and few between. But the hundreds to thousands of things you do a day that are killing you, if we at least address those, and someone says, well, I'm not going to address those or their doctor's appointments, Kevin, well, now we know what's going on here. But if someone's like, sure, I'm going to keep my doctor's appointment, but yes, I will work on reducing all the things I do online, behavior and mentally, to solve an existential crisis that I can't solve, to solve this 100-piece puzzle, but I'm missing piece 999, so I can't actually solve the puzzle. If you're willing to give that up, and I don't care about your doctor's appointment, but if you're not going to give those up, then honestly, your doctor's appointment doesn't matter, because whether you find out you have something or not, you're going to spend the next 10 years of your life chasing things that have shadows. And I know enough about shadows to know that unless you stand still and die, or just stand under the light and not move, either one of those is death, you can't catch your shadow unless you're Peter Pan.
And he had trouble with it.
He had trouble with it.
Yeah.
So I don't support people spending their time doing all those microcosmic rituals. But if you want to go for another consult, God bless you. Go for it. I'm not going to get in the way of that.
I think that's a really helpful and nuanced way to view this, that we're not saying never. We're not saying don't care for your health. We're saying open yourself up to living your life now. Between now and that time that you do get that test, there can be freedom in life and fun and joy within those two things that otherwise would have been filled with stress and reassurance and stuff that ultimately doesn't let you live your life. You're living outside of that in a fantasy land where you have it, you don't have it, you might have it, but you're ignoring the present moment of life. That
having lost people to cancer, and having had people in my family and loved ones who have beaten cancer, to me, the real cancer is what you just described, Kevin. Spending your day chasing something that you'll never actually be able to catch. And that's a death I don't wish on anybody.
And the other thing that just comes to my mind when we think about this dynamic, right, is like, so we have this openness to be, if you want to go for that consult, if you want to go to the emergency room, so be it. If we can cut out those smaller things. And then I think at some point, the question we have to ask ourselves is, there's going to be a competition of time. Mm-hmm. And so there's going to be a moment where maybe we get much better at leaving WebMD alone, or stop bugging our Uncle Larry, or whatever it might be. And we might be getting down to these times where we're still pursuing medical appointments. We might be pursuing the emergency room. And one of the discussions I think is really important to whether it's to consider in your own mind or to have with somebody is, people might know this or not, but usually if you go to the ER, it's usually not a short experience. At least here in St. Louis. I don't know if it's anywhere else. But that's a chunk of time. And so how is that also impacting your life? Because if there's this chunk of time that we could use sitting in the ER for 8 hours, mm-hmm. But now we're missing important life events or things with family, mm-hmm. or missing work, boy, those become some really tough decisions. Mm-hmm. And so maybe we can even set up this dynamic of a fork in the road of saying, I still may feel like I need to go to the urgent care to get this checked out. However, I have to wrestle with myself in this situation to say, if I do that, I might also have to sacrifice other important things in my life. Mm-hmm. Is that worth it? Now, again, we can't make that decision. But it is a really important dynamic that I like to kind of lay out for people to say, these are still things that you could go do, but they're also going to have consequences on the other side of them. And we just don't get that time back. And so, maybe there's some times where, if 90% of the time you go to the emergency room anyway, sure, mm-hmm. Go for it. However, if there's 10% of the time that we can make that decision to say, you know what, I'm just going to bank on this not being a thing. And if the flight attendant is not freaking out, I'm just going to try to not freak out either, unless the plane really goes down. And if that's the case, we talk about this in towards the end of the book too. We hope that as we're talking about health anxiety, we're not just talking about how do we reduce rituals? How do we stay out of the ER? How do we stop worrying about things? But the most important thing that I really want people to be able to get back to is the life they're afraid to lose. And if we're in the ER, we're losing life. And so I think there's a really important and difficult decision point that we have to make at some points to say, maybe there's sometimes I could stay home and spend some quality time with a family, kids, a spouse, whatever it might be. And is that scary? You betcha. Is it valuable? Yeah.
It's a strong values-based decision that they're going to have to make. And it can feel like you're saying to make one decision, you have to say the other one's unimportant. To say my family is important means that my health is unimportant. And it's certainly not what we're saying. It sounds like that's not what you're saying in this, is you're saying both of these things can absolutely be important, but which one do you want to win out for this moment? And each of those can be individual choices that you make. And if all your choices are then about your health, you do sacrifice this other area. And is that the choice and the decision you want to move forward with? It sounds like there's a lot of conversation and consideration that can be done around that.
Absolutely.
And I don't think the battle has to be between the joyful and loving activities that Michael just alluded to, which we spend time in the second to last chapter, not called the second to last chapter. It's actually called Stuff About Joy, bringing back positivity in your life from warrior to warrior. We're talking about addition by subtraction, which is getting rid of rituals. And then we're talking about addition by addition, which is adding things to your life. So a lot of the work that anxiety specialists do when we talk about ritual prevention or stepping back from your anxiety or recognizing that you're inferentially confused or giving up this narrative or stepping back from the bubble if you're following an ICBD approach, or anything else like this, is you're trying to give up the negativity. And that's addition by subtraction. All of us in our favorite sports teams want to get rid of that worst player. And when we get rid of them, we're a little bit better. We're not a lot better. We're a little bit better, but we get a lot better by signing the best quarterback, the best wide receiver, hiring the best coach, adding the best. So a lot of the interventions are about removing stuff out of your life that's not helpful. And the other part is adding things to your life that have been missing or not attended to as you've been searching for answers. And so I don't know, Kevin, if it's as much about family versus my health as it is about family versus, as I love what Michael said, the loss of time. And one of the reasons that people are so health anxiety focused is probably a lot of them are fearful of, losing time, dying prematurely, missing out. And like, what an ironic way to honor that by wasting time doing things that are actually detracting from your life. So if we can help people with all the CBT skills that we teach people, give up some unhealthy behaviors, habits, and responses, which typically is called ritual prevention. And we can teach them to reorient back towards values-based actions. Again, values are not goals. Values are actions. Nike nailed it when they said, just do it. They didn't say, just think about it or just consider it. They said, just do it. Do anything. Just do it. And so doing it in this case is doing the things that matter to you, that move you forward. And so a lot of the book talks about the beginning, middle, and end. Stop doing things that are running away from, which is what health anxiety and OCD is all about, and start doing things that are running towards, adding to, building. And I don't know anyone who would say that I've spent more time with my family, I've added to my life, I've brought more joy and harmony into my world. I don't know anyone who would regret that, even if they found out in the process they were battling a medical issue. And I even in the book, I get very transparent and share an experience with my father, who I love to death. And I got pictures all next to him over here in my office. And he was my hero and mentor. And I wish you could see me with this book out and all the wonderful things in my life that he meant so much to me. But he died in his early 70s to stage 4 lung cancer that spread to his brain cancer. And the guy never smoked a day in his life. Never smoked a day in his life. Now, he traveled on airplanes for probably 30 years with the work he did. So he was around smokers in the 70s and 80s. And in the 70s and 80s, everyone smoked. So, but the old adage is the guy never smoked a day in his life. And I'm very proud of that. And he died of lung cancer and brain cancer. But until he was ill, which was the last 8 months of his life, minus like, I think, a hip injury. And this guy was never sick a day in his life. Until the day we found out he had lung cancer and brain cancer, he lived the fullest life. And if he spent the last 4 to 6 years chasing cancer that he didn't have, would he have more years afterwards? It's possible. You know what? We don't know it's possible. But I don't want him to spend those final 5 to 10 years chasing cancer. I want him to spend those last 5 years living the most amazing life possible. And so, yeah, we lost him. Broke my heart. He's my hero. I love him and I miss him every day. It's been almost 10 years. But he spent every day living the most full life. And what happened to him happens to everyone. Got sick and died. Sucks. But what he didn't do is lose time in life chasing the possibility of death. And so I'd give anything to bring him back, but I wouldn't give anything to have him alive and spend 10 years chasing an illness that doesn't exist. And that's the story of this book, which is, unless you're battling an identified medical issue that's imminent and dangerous, which some people out there are, and for all of them, we pray for you, we love you, and we hope you get better. For the rest of you, it's time to let go of that chase. Drop the rope and start doing things that add to your life and bring joy and harmony to the people around you that love you to death. And if you can pursue that, go to your doctor's appointments, be vigilant about your physical, medical, and psychological health, but look around and realize what you're missing out on. And most of us don't want to spend our final years chasing something that doesn't actually matter. So I just hope when people read this book, they're inspired by some of those stories that Michael and I personally shared, and that we teach specific skills to teach you how to let go of those things and not just do addition by subtraction by giving stuff up, but addition by addition. Add more things to your life that give you more purpose, meaning, and intentionality. And I think that's what all of us as therapists, Kevin, try and bring to all the people that we work with.
That's incredibly well said. I'm struggling to try to find a fancy way to tag on to that to make myself sound really smart too. But well done.
I can give a funny joke if you want, or a quick.
I don't have any funny jokes for that. I think that was beautifully said. I'm sorry, and I'm looking at the time, and I know there was one aspect that I know we talked about that we wanted to address about the challenge of doing ERP from a book, or the challenge of being able to address that effectively from a book, especially in the light of health, right? Because when we're talking about response prevention, we're talking about pulling back on compulsive behaviors, but those compulsive behaviors are theoretically safety behaviors, right? And in the light of you could miss it, talk about the challenges, if you could, of helping someone through exposure and response prevention via a book.
It's a good question.
One of the challenges we had was, how do we not guide someone down the wrong path? Mm-hmm. How do we help someone learn skills that we offer in therapy, knowing that a lot of people who read this book or who read books like this probably will not have access to a therapist because there's not enough Kevins and Michaels and Joshes around the world. There's just not. And how do we teach people a skill that most of us believe wholeheartedly saves lives? And that skill is called exposure therapy. And it's a skill. And done in the wrong hands, it can mess people up. Mm-hmm. If you do exposure therapy too harshly or too fastly, it can flood someone. It can overwhelm them. It can make them feel more scared and less secure about what they're doing. And so Michael and I went back and forth on this, is do we add a chapter in here about this magical mystery tour called exposure therapy? Because if it's done poorly, it can really actually cause some damage. And there's research to support that, which is poor exposures can actually traumatize or hurt people. But clinicians who are trained in this are trained on understanding how to push it and how to pull back, how to have the client or patient be an agent and choose what they're doing, how to give them the options, how to empower them to make those calculative decisions of when do I do something and when do I not. So we wrote a chapter about exposure therapy, and we were very specific about not using the phrase exposure therapy as sort of the tool, but we call them challenges. And we call them challenges, Kevin, because everyone in the world faces fear. Everyone in the world experiences anxiety. That's a ubiquitous experience, which means technically everyone at times in their life have to face fear head on. And fortunately for most of us, most things that feel fearful are not actually dangerous. Thank goodness. Or this would be a much scarier place. But our brain doesn't care. The amygdala, the limbic region, our brain doesn't decipher. When we're in fight, flight, or freeze, it doesn't know whether it's a cougar and a leopard in a car about to kill us, or if it's just me on a treadmill with my heart pumping. So the brain doesn't know the difference, but we do. And so this chapter about exposure therapy, which is part of the E of ERP, is really about teaching people an empowering skill of find something that you are scared of, that you were scared of before you ever read the book, and find a way to creatively engage with it in a way that is up to you, at your dosing, at your timing, under your decision, and see if you can get on the other side of that scary event, assuming that scary event does not pose real imminent danger. Mm-hmm. So there's a lot of books out there, Kevin, that our colleagues have written that we love that have included exposure therapy. Some of them are more academic for therapists like us, and some of them are more for the lay consumer. And it's a hard balancing act to write about how to face fears head on. And so Michael and I went in depth. I mean, we went almost manualized about here's how you set it up. Here's what you should document. Here's how you try it. Here's how you pull back. We try to get as prescriptive as possible. Mm-hmm. And maybe we were too prescriptive and too meticulous. And maybe we weren't meticulous enough, but we knew we wanted to talk about the concept of taking brave actions, which, by the way, we do this with 5-year-olds and 7-year-olds and 9-year-olds in our practice all the time.
Absolutely.
So there are kid therapists. I treat all ages, and a lot of people on our team at Anxiety Specialists of Atlanta, here in Atlanta, treat all ages. So we do this with kids all the time. You know what we do, Kevin? We do it with kids in our office, often with their parents as well. We send them home and say, go try that challenge on your own and come back and tell me all about it. And we have parents helping them with that. And then we reward them and we make it fun and creative. It's almost an extension of play therapy. Mm-hmm. It's just play therapy with bravery. So Michael and I really wanted to add a chapter in here about this concept of how to experience fear under your control, because fear and anxiety is the antithesis of control. and removes a feeling of control out of our lives. So, did we execute the chapter perfectly? Honestly, I don't know. Only time will tell. But it was our attempt to bring something that is very manualized, very secretive, and done in a laboratory to people's homes through our paperback and ebook. And hopefully that people can take this and find fun, creative, and lighthearted ways to face challenges that they face every single day with more bravery, with some fun in their own life. And if they can do that, they've cracked part of the code of living the fullest life. And instead of living in fear, doing it by living with fear. And if they can do that, man, they're doing better than most of us. Michael, what are your thoughts on that exposure chapter?
I'm just reflecting back. I can't, the amount of discussions that we had to try to figure out where to put this, how to put this.
Or the hardest one to write.
Yeah. Yes, correct. All great points. And I think this is where it goes back to our beautifully named first chapter, is that, put into hands of not doing this intentionally. There's a lot of perspectives or ways that you could approach exposures or challenges that are just not helpful. And I think that's where we started with the first chapter of just this idea of like, how do we lean into things? How can we have this mindset? And I was looking through and, the other thing that we just kind of put in there was just, and that I hope that we can embrace is how do we think like an exposure therapist? Because like what Josh had mentioned, we don't want you to go into exposures as just like, let's just get this thing done. Let's go through this chapter and just barrel through it. Because those are not going to be helpful. However, I think the challenge of that was attempting, and like Josh has said, maybe we hit the mark, maybe we're off. We're not sure yet. But this aspect of how can we at least prepare you to think in this way about leaning into things. And just like what we were talking about with the entire book is how can we do it and start to shift that relationship of how we relate, kind of back to your question that you were talking about in the beginning of the podcast, Kevin, of like your relationship with some of these different types of things. Mm-hmm. Whether it's the relationship that we have with our physical symptoms, the relationship that we have with just our health in general. I know this often changes for people, just in different phases of life, right? Like our relationships with our health start to change. And it's like, so I think one of the things that we were trying to be very intentional about was trying to embrace this mindset of what is going to be the most helpful and productive way to be able to approach some of these challenges. And then going back to our discussion about adding things to our life, that we hope that as we're practicing these challenges, some of these challenges might relate to some of the things that you would really like to do. I know there's multiple clients I've worked with that maybe the biggest concern is if they like to go out to sporting events or movies or anything that's a fun experience, but it also can be a scary experience because then we're looking up, well, how far away is the nearest hospital? Can somebody get to me in time? And if it's too far away, I don't think I can do that. Now you better believe that is a challenge. If we were going to say, but I really do want to go to this game or whatever, or this event, whatever it might be, this concert. And so we start to kind of think about how we can incorporate some of those really positive and meaningful things in our lives in terms of, okay, so a hospital may not be as close to me as I would like. However, maybe I can take on that challenge. Maybe I can lean into that. So I think this mindset that we were really trying to help people prepare for, knowing that they're not going to probably have a guide there with them every step of the way, to be able to try to set things up that people could engage in some of those challenges. Like Josh said, we would give to people as, like, well, why don't this week you try that out? So then that way, maybe they can start to overcome some of those things that they're most concerned about. And also they get the benefit of having something added back into their life that's really positive.
Love that perspective. Love that perspective of having a goal, having a direction that you're moving in that's positive, that's desired, and is the life that person actually wants to live, as opposed to just doing a bunch of weird exercises about someone's health or doing something that is intentionally poking the bear of their anxiety. It's instead, let's focus on that thing that they actually want out of life. And isn't that the point of therapy in the first place?
Absolutely.
Amen.
Yeah. Well,
now,
go ahead.
I was just going to add one more thing, but if we need to wrap up, that's cool too. The one other thing that we just laid out in the exposure chapter that might be a little bit different, happens in panic, is there are some considerations that we need to take in terms of just physical symptoms in itself. And sometimes that's the other thing that we have to just make sure that whether it's dizziness, lightheadedness, those are usually what we discuss as interoceptive exposures. Is there anything that's really dangerous about dizziness? No. Is there anything that's really values driven about dizziness? I don't think so, unless anybody really values being dizzy, which, okay, I'm not going to judge you, but I think there's a lot of different things within that chapter, whether it is a little bit more targeted towards, hey, how can I change my relationship that I have with these physical symptoms? Or back to what you're talking about, Kevin, how can I move my life in a more positive, valued-filled direction? That I hope that if we can start to apply some of those, not only are you probably moving past some of the parts of your health anxiety, but you're probably getting a lot of your parts of your life back too. So,
absolutely. Well, yeah, I know we're getting to a little bit of the end of our time. I know some of us still have clients in our day, but is there anything else that you'd want to tack on at the end to either give folks some encouragement who may be struggling with health anxiety, or a family member who's struggling with health anxiety, and they're just looking for a little bit of optimism, potential hope, or a direction on what they can do? What would you say to that person who may be needing a good word?
Get down with disease. What I mean by that is if you can start to be okay with the possibility of whatever you're battling and be down with disease, and realize that until you're medical, there are 100 other ways to cope with and live with these fears. This book and therapists like the three of us spend all of our time helping people face what feels like very real battles. And they are real battles, but they can be faced and handled in a different way. And the reality is that these are very scary things that can really take the life out of you, and they don't have to. And there are resources out there, including this book, obviously, the website that we've launched, overcominghealthanxiety.com, the International OCD Foundation, podcasts like this that we love, Kevin, and wonderful YouTubers out there that are providing lots of wonderful free resources to remind people that thoughts are real experiences, but you don't have to buy every single thought you have. Mm-hmm. And we are judged not by our private events, not by the things that are inside of us, not by our thoughts and feelings, but by the things that we say out loud and the things that we do. All of us are walking around with all sorts of insecurities and fears, vulnerabilities and things that we're not proud of on the inside. That makes us human. But what people are judging us for are the ways in which we show up and the ways in which we live our lives. And I just hope that people recognize that they're not alone, that there's a large network of therapists out there fighting every day with you to give you the life that you deserve. And if you can step back for a moment and recognize that the things that you're most scared of, which are real fears, don't have to be the things that motivate you and drive you. There is another way to live a full life other than ritualizing, compulsing, and following a narrative that wants nothing from you except to watch you suffer. And I don't believe that's the human experience, just to suffer. I think it's about connection and livelihood and supporting each other and being kind to each other. And that requires you to be kind to yourself and to give yourself that space and grace to go, listen, this is not easy and this is not fun, but I don't have to do it by myself. So I'm grateful that individuals like you have these podcasts, because as many clients as we all see that we all have to go to in just a few minutes, it is these media platforms and organizations like the IOCDF that are going to have a bigger impact, because these are the things that people share. And these are the things that are easily accessible and that they're free. And so we're here to offer what we believe are some of the leading best practices out there that we've digested down to a very affordable book. But these are things that we do in our practice. And so Michael and I were dead set on writing a book that we were proud of, but writing a book that felt like you were in session with us. And so one of the biggest compliments that someone can give Michael and I if they read our book, if they put a review on Amazon, or if they reach out to us, which our email for this book is in the book, is it felt like I was in therapy with you guys. And if anyone has ever spent time with us, and I guess if they listen to this podcast, they have, Kevin, we take this very seriously. We don't take ourselves very seriously. So that's the kind of therapist you're going to get. We're going to fight till the final moment to give you the biggest life you can. But we're going to do it with humor and compassion and kindness and sarcasm and sprinkling in a few scary statistics. And if you get that from us, you've gotten what I think is the best of the best that science offers. And that brings together the art and science of what psychotherapy is. And it's been a pleasure to write this book with Michael and to get it out there. We hope that you guys experience what it's like to be in session with us, even if we never get the pleasure to meet you.
Yeah, just one more thing that I would add real quick and we can wrap up is, I was talking to a good friend that's a family physician. And, there's a lot of those experiences where if somebody keeps coming into them with health anxiety, they want to help, but they're not quite sure what to do anymore. Mm-hmm. And I'm sure there's a lot of, they say 5 to 10% of the population. Although I think that's probably undercutting things because there's probably a lot of people going to doctors. And I think there's one thing I just want to touch on real quick. And that just my takeaway for hope is there's so many times, and I'm sure there's millions of people that right now go to doctors, can't get an answer. That scan didn't show anything. That test didn't show anything. There's no answers. This medication is not working. Why can I not find an answer? And if there's not a place of hopelessness, that would be it. And I wish people, and this is why it's so awesome to be able to be on this with you, Kevin, is if there's some way that we could teach people or at least let people know there's something we can do about this. It just may not be what you think it is. Life can come back. And I think that's one thing that's always really driven me during this is just that pursuit. And I think it's pretty similar with OCD, right? Because people have tried a lot of different therapy and it has just kind of felt hopeless. And I think that's what I hope to be able to bring to the health anxiety space, which is there's actually something that you can do. It just might not be with a medical provider. So I think that's the one thing that I would want people to know, because life can come back. And that's pretty amazing.
Love it. Guys, thank you so much for joining me today. So I'll try to include some of your contact information if anybody wants to find more about you. If I get some questions about health anxiety, do either one of you be willing to jump back on a future episode to help talk about some health anxiety questions?
Would be our absolute pleasure.
Absolutely. Yep.
Awesome. Well, you heard it here, folks. If you have questions, throw them at me. I'll try to wrangle these two fellas back in. And we'll
as long as we call it lovingly the second podcast on health anxiety, just like our first chapter is the first chapter of 10. We could call this the second chapter or the second podcast on health anxiety.
Done.
Or part two.
Well,
you better know the reference.
And I'll put up the vote for people on Instagram if you want to.
There we go. Love it.
Question. So, again, thank you so much for joining me to talk about your book. Go check it out. I'll put up a link to it. And again, thank you guys so much.
Thank you, Kevin.
Thank you for listening to the Fearcast. If you would like your question answered on a future episode, please click on the Submit a Question link at fearcastpodcast.com. If you would like your question answered sooner, please send me a recording of your question to questions@fearcastpodcast.com or by sending me an audio message through Instagram by DMing me at fearcastpodcast on Instagram. If you like the Fearcast, please write a review on your podcast platform of choice. Please remember that the Fearcast is not a substitute for psychotherapy. If you need a little bit of help in your recovery, please go over to fearcastpodcast.com and click on the Find Help link, and there's going to be some information for you there. So until next time, take a risk, challenge yourself, and don't take your brain too seriously. Bye.